Let's begin with some good news. The liver has an amazing ability to repair itself. If you avoid alcohol or lose weight, it's possible to reduce liver fat and inflammation and reverse early liver damage. But what is fatty liver disease? Fatty liver is also known as hepatic steatosis. It happens when fat builds up in the liver. Having small amounts of fat in your liver is normal, but too much can become a health problem. Your liver is the second largest organ in your body. It helps process nutrients from food and drinks and filters harmful substances from your blood. Too much fat in your liver can cause liver inflammation, which can damage your liver and create scarring or cirrhosis of the liver. In severe cases, this scarring can lead to liver failure. When fatty liver develops in someone who drinks a lot of alcohol, it's known as alcoholic fatty liver disease, or AFLD. In someone who doesn't drink a lot of alcohol, it's known as non-alcoholic fatty liver disease, or NFLD. So what are the symptoms of fatty liver? Number 1. Pain in the upper right abdomen. The liver is a large vital organ, and it occupies space behind the lower portion of the right rib cage. One of the few symptoms of fatty liver disease is pain in this general area, usually in the upper right quadrant of the abdomen, just below the rib cage. The pain occurs when the fatty liver disease progresses to inflammation and enlargement of the organ, which stretches the liver's covering and causes discomfort. Number 2. Unexplained tiredness. One of the most common and debilitating symptoms among individuals with liver disease is fatigue. Fatigue may occur at any time of day, but is most common in the morning about an hour after waking up. By 9 a.m., one may already feel the exhaustion of a full workday. Others describe weakness and a lack of energy throughout the entire day. Even little tasks become more trying, and around 4 p.m., they simply must lie down to take a nap. Your doctor likely will first try to rule out simpler explanations for fatigue before progressing to a diagnosis of fatty liver disease, unless you exhibit other symptoms like right upper quadrant pain, or if you're at high risk for fatty liver disease due to obesity, high cholesterol, family history, or heavy drinking. Number 3. Elevated liver enzymes. If you have type 2 diabetes, metabolic syndrome, or another condition associated with fatty liver disease, your doctor may perform a blood test to determine if you have a fatty liver, even if you don't have symptoms. Elevated levels of the enzymes aminotransferase and aspartate aminotransferase indicate liver dysfunction of some kind, which could be caused by a fatty liver. Your healthcare provider will consider these test results in combination with your personal history, current physical condition, risk factors, and the results of additional tests before confirming a diagnosis of fatty liver disease. Number 4. Loss of appetite and weight loss. In liver damage, especially in the severe stage of fat accumulation, hormones that regulate hunger becomes disrupted. Leptin is a hormone that modulates appetite and reduces food consumption. When leptin levels are above the normal average, it can cause loss of appetite and lead to sudden weight loss. Number 5. Nausea and acid reflux. A study done in 2009 found that people with fatty liver disease were more likely to have gastroesophageal reflux. Also, these people had more heartburn and burped more often. Gastroesophageal reflux is a condition in which stomach fluid moves back up into the esophagus. It can make you feel sick and nauseous. Another reason for nausea is that the liver can't get rid of toxins and waste, which hurts the lining of the stomach, resulting in reflux. Number 6. Long-lasting itching. Liver failure is sometimes accompanied by itching, but you can develop itching early on before you even know you have liver disease. In fact, itching can develop at any point in liver disease, though not everyone with liver disease develops it. Itching associated with liver disease tends to be worse in the late evening and during the night. Some people may itch in one area, such as a limb, the soles of their feet, or the palms of their hands, while others experience an all-over itch. Number 7. Yellowing of the skin and whites of the eyes, also known as jaundice. This yellowing of the skin and whites of the eyes are a result of bilirubin, which is a bile pigment. Bilirubin builds up in the blood, and the damaged liver is unable to eliminate it as waste from the body, causing the skin and eyes to turn yellowish. So these were the 7 symptoms of fatty liver disease. If you observe these symptoms, get a blood test, ultrasound, or biopsy to be sure about your liver function. However, in many cases, lifestyle changes can help reverse most stages of fatty liver disease. For example, depending on your current condition and lifestyle habits, it might help to lose weight, reduce or abstain from alcohol consumption, and eat a nutrient-rich diet that's low in excess calories, saturated fat, and trans fats, and get at least 30 minutes of exercise most days of the week. Generally speaking, the outlook for fatty liver disease is best when treatment begins in the early stages. For the best outcome, it's important to follow your doctor's recommended treatment plan and practice an overall healthy lifestyle. Thanks for watching. If you liked the video, then give it a thumbs up. And now go ahead and watch any of the 2 videos on your screen to learn more about your health and wellness.